segment is sponsored by Springfield Clinic. For today's Wellness Wednesday, we have Dr. Katherine Thompson here with Springfield Clinic Urgent Care to discuss summer injuries. Dr. Thompson, thank you so much for being with us.
No problem. Thank you for having me.
Of course. Okay, we want to talk about those summer injuries. A lot of people are outside playing, at the park, a lot of different activities. How common are those kinds of injuries in the summer months?
I mean, they tend to be fairly common. I would say we see several people a day with various injuries to different joints, ankles, wrists, arms, legs. And so, yeah, we see them pretty much on a daily basis, depending on what the weather's like.
What are some of the most common injuries that you're seeing from patients?
Some of the most common injuries tend to be ankles. People feel like they've twisted their ankle or they've tripped or they've fallen and they think that they've hurt their ankle. Other ones would just tend to be falls where people have tried to catch themselves and they've then hurt either their wrist or their elbow. Those tend to be the most common, though we see lots of different injuries.
Now, if someone does come to you and they need an appointment with urgent care, is there anything different since we're also dealing with a national pandemic?
We have a couple different ways that people can make appointments if they wish to do that versus just walk in when the injury first happens. You can get onto the Springfield Clinic website, and there's the ability to set an appointment for our different locations, depending on which one you would like to be seen at. We also have the ability to do telehealth for some appointments, though a lot of times with injuries, we're usually looking at possibly doing an x-ray, and so obviously telehealth visits are not ideal for injuries.
With the telehealth appointments, a lot of people are, still getting used to that and learning about that. What's the process like? Is it face-to-face interaction with the doctor? Are you talking with a nurse? Tell us a little bit about it.
Yeah, so for our telehealth appointments, we have a video platform. It is the same thing you would do to get a in-person visit. So you would go onto the website, and when you're asking for an appointment, it will prompt you if you want to be seen in person or if you would like to do it via telehealth. If you choose the telehealth one, it'll have instructions kind of making sure that you have the technology that works with our platform to make sure you have video and sound that will work with our system. But it is kind of like a FaceTime or a teleconference type of thing where you would be seeing the doctor directly. We do have someone who calls you before the appointment just to verify your information with insurance and make sure that the technology is likely going to work the way it should do. But when you're actually in the visit portion of it, you'll be looking and talking with either the physician or the nurse practitioner.
Okay, Dr. Thompson, thank you so much for being with us. We really appreciate your advice.
No problem. You guys have a good day.